Usually when we talk about a medical diagnosis, there's this expectation of precision, like it's just basic engineering.
Right, yeah, like you break your arm, they do an x-ray, and there's that jagged white line.
Exactly. The doctor just points and says, yep, there it is. Broken or not broken, it's clean.
It is, yeah. I mean, it's comforting. We really like human biology to be visible and, neatly categorized.
But then you step into the world of neurodevelopment and reproductive hormones.
Oh, yeah. That x-ray machine just completely shatters.
Totally shatters. The diagnostic landscape gets incredibly murky. And that is exactly where we're taking you today in this deep dive. We're exploring a hidden midlife crisis that medical science is honestly only just starting to figure out.
Right. We're diving into a very specific but just devastatingly impactful question. Does the combination of neurodivergent sensory masking and perimenopausal sleep deprivation significantly increase the risk of severe autistic burnout?
And to figure that out, we really have to synthesize a huge stack of recent medical journals. Stuff from Autism and Medical Hypotheses, articles from Samfire Neuroscience, guides from the National Autistic Society.
Right, and crucially, those lived experience accounts from autistic adults, because the clinical research is really just catching up to what they've been saying for decades.
Yeah, exactly. So whether you are neurodivergent yourself, or maybe you're supporting a loved one, or honestly, even if you just want to understand how profoundly hormones alter the human brain, this deep dive is going to fundamentally change how you view midlife.
I mean, it really shifts how you look at energy and resilience overall. Because to understand this massive midlife crash that so many autistic women experience, we first have to talk about the baseline cost of just, existing.
Existing in a neurotypical world, right.
Yeah.
Which brings us to the concept of masking.
Right, exactly. Masking or camouflaging is essentially that active, continuous effort to suppress autistic traits so you can meet societal expectations.
Like scripting out conversations or forcing yourself to make eye contact.
Yeah, or suppressing the need to stim. And a recent study led by Evans directly links this higher level of masking to just profound exhaustion and burnout.
But wait, I have to push back a little here. Doesn't literally everyone adjust their behavior at work or, in public?
Well, yeah, people put on a professional face, sure.
Right. So what makes autistic masking so uniquely exhausting that it leads to clinical fatigue? Like, why is it so much worse?
Because it's not just being professional, it's a vast biological difference. Advocate Rosie Weldon actually describes it as rewriting every fiber of your being to suit a situation.
Oh, wow. Rewriting your whole being.
Yeah, it's a manual override of the nervous system. You're asking your brain to manually execute social and sensory processes that are supposed to happen automatically.
Okay, so it's not just being polite or biting your tongue.
Not at all. And this ties into the sensory gating aspect. For a neurotypical brain, sensory gating is just this automatic filter. You don't even think about it.
So if you walk into a busy office, your brain just naturally turns down the volume on the fluorescent lights or the chatter from the next cubicle.
Exactly. But the autistic nervous system often completely lacks that automatic off switch, so ordinary environments are incredibly demanding.
I always think of it like a smartphone. Like, for most people, sensory processing is this lightweight background app.
Right, it runs efficiently.
Yeah. But for an autistic person, masking and sensory processing are like running these massive, unoptimized apps that just completely drain the battery while you're literally just trying to buy groceries.
That's a great analogy. It's an active, heavy drain on the system every single second of the day.
So if masking is this heavy background app draining your battery, what on earth happens when the battery's maximum capacity suddenly just shrinks?
And that is exactly what brings us to perimenopause, because the math just completely breaks down.
Right, the years leading up to menopause bring these wild fluctuations in estrogen. But culturally, we usually only talk about estrogen as a reproductive hormone, hot flashes, fertility, that kind of thing.
Yeah, but Dr. Dangman recently published this fascinating hypothesis that reframes estrogen entirely. It's not just reproductive. It influences the exact same brain systems affected in autism.
Wait, really? Like which systems?
We're talking serotonin pathways, dopamine regulation, and your executive function. Estrogen actually acts as this powerful hormonal buffer that modulates that sensory gating we were just talking about.
Okay, so I'm imagining it like acoustic paneling in a recording studio. Like when estrogen is high, that paneling is thick, absorbing the shock of loud noises.
I love that visual. Yes. It softens the sharp edges so you can actually function and mask.
Right. So to you listening, imagine relying on that specific internal shock absorber your whole life. And then in your 40s, someone just comes in and unbolts it from the wall.
Yeah. How would you cope? A recent review by Grant and colleagues found that as estrogen drops, the world literally gets louder for autistic people.
So every sound just echoes. Is this why women often describe feeling like they're losing their minds during perimenopause? Or is that specific to neurodivergence?
Well, neurotypical women definitely experience brain fog and mood swings from that estrogen drop. But for autistic women, it's frequently described in the qualitative research as menopause on steroids.
Menopause on steroids, that is intense.
It really is. It's the abrupt removal of those neurochemical supports. They unknowingly relied on them to regulate an already highly sensitive nervous system for decades.
So the sensory volume is suddenly cranked to maximum. How do you even power down at night when the world feels like that?
Well, you don't, and that's where the multiplier effect comes in, sleep deprivation.
Right, so the battery is shrunk, the background apps are heavier, and now you literally can't even plug the phone in at night.
Exactly, and the baseline for autistic sleep is already super precarious. Research by Sidhu and colleagues shows that 40 to 80% of autistic individuals already have clinically significant sleep problems.
And that's before menopause even starts.
Oh, yeah, way before. Circadian rhythm disruptions and insomnia are incredibly common core issues.
So you take that already fragile sleep system and you layer on the classic menopausal symptoms. Night sweats, hormonal insomnia, waking up at 3 a.m. and just staring at the ceiling.
Right. And sleep is the brain's deep cleaning crew, it flushes out metabolic waste. So when you chronically deny an autistic brain that cycle, it creates a terrifying bidirectional loop.
Meaning the autistic traits disrupt the sleep, and then the lack of sleep makes the traits worse.
Exactly. The sensory sensitivities make it impossible to sleep, and then poor sleep severely worsens your sensory tolerance and executive functioning the very next day.
It just obliterates your ability to organize your day or remember anything. I remember reading about this concept of energy accounting in the guides we looked at.
Yes, that's a huge concept among neurodivergent advocates.
Like if your daily cognitive energy is a bank account, a good night's sleep is your daily deposit, and masking is your withdrawal. But in this scenario, your deposits are cut to zero because of insomnia.
And your withdrawals are doubled because the sensory overload is so much worse without estrogen.
Right. So mathematical bankruptcy is just inevitable. But surely when people go to their doctors experiencing this, the medical establishment recognizes the compounding effect of the lack of sleep.
You'd really think so. But unfortunately, no. They usually run into what a recent study by Brady calls the quadruple empathy problem.
Wait, quadruple empathy problem. Break that down for me because that sounds like a massive systemic failure, not just a bad doctor.
It is a total systemic diagnostic breakdown. First, the autistic patient might have atypical ways of communicating their distress, like blunted facial expressions, or struggling to articulate the exhaustion.
Okay, so they aren't signaling pain the way a neurotypical doctor expects.
Right. So second, the neurotypical doctor completely misinterprets them. They view the fatigue entirely through the standard lens of regular menopause and completely miss the neurodivergent context.
Oh, wow. So they're just seeing the standard X-ray and
Yeah.
missing the underlying reality. What are the other two layers?
Third, the doctor gives standard neurotypical advice like basic sleep hygiene. Take a warm bath, read a book, which is notoriously useless for severe sensory-induced insomnia.
Yeah, a warm bath isn't going to fix a fundamentally overheated nervous system.
Exactly. And finally, fourth, the patient tries these neurotypical solutions, they obviously fail, and the person just feels entirely alienated, broken, and unsupported by the medical system.
So they get sent home with like a pamphlet on hot flashes and maybe some melatonin while their brain is basically collapsing. And when you hit that mathematical energy bankruptcy, you cross the clinical threshold, right?
You do. You transition from autistic fatigue into full-blown autistic burnout, and the distinction there is absolutely paramount.
Right, because fatigue is just the heavy daily exhaustion of navigating a world not built for you. You can recover from that with a massive reduction in sensory input and a good night's sleep.
Exactly. But autistic burnout, based on foundational definitions by researchers like Raymaker, is pervasive, long-term exhaustion lasting months or even years.
Months or years. That is terrifying.
It is. It includes a drastically reduced tolerance to stimuli, but the most critical marker, the one that stands out everywhere, is a profound loss of previously held skills.
The phrase loss of skills almost sounds, I don't know, too sterile for what's actually happening in real life.
It really does. In the Brady study, participants described this abrupt transition where they literally became unrecognizable to themselves.
Right, we're talking about adults who've been successful project managers for 20 years, suddenly losing the executive function to sequence making a cup of coffee.
Or individuals whose bodies literally just stop working in public. The sensory load of a grocery store forces their nervous system to pull the emergency brake.
Like extreme meltdowns or their legs giving out or even losing the ability to speak completely.
Yes, they aren't choosing not to speak. The brain is just refusing to process one more bite of information. Many have to leave paid employment entirely because masking is physically impossible.
But if I'm an adult who suddenly can't hold a job, can't speak reliably, and I'm withdrawing, and I go to a doctor who doesn't understand that quadruple empathy problem, aren't they just going to diagnose me with clinical depression?
All the time. It is one of the most common and dangerous misdiagnoses for this demographic.
Dangerous because treating burnout like depression can actually make it worse, right?
Completely. It fundamentally misaligns the treatment with the biology. Depression is a primary mood disorder, usually involving a pervasive inability to feel pleasure or hope.
But autistic burnout is a functional systems failure caused by chronic stress.
Right. An autistic person in burnout might still have deep passions or special interests they desperately want to do. They just lack the neurological energy to execute the tasks.
So if a doctor treats it with just antidepressants and tells them to push through it or try behavioral activation.
It's pouring gasoline on a fire. You are demanding more output from a nervous system that is already bankrupt. Treating burnout requires mandatory rest and massive sensory reduction.
And because this specific burnout is so widely misunderstood, it actually leads to this really surprising phenomenon, the midlife autism diagnosis.
Right. The statistics on this reveal a massive blind spot. In the Brady study, 2/3 of participants literally did not know they were autistic when they entered menopause.
2/3. And I think the Autistica survey said over half of their respondents were completely unaware too.
Yeah. Think about the psychological weight of that. You spend 40 or 50 years thinking you're just a flawed, broken, neurotypical person who has to try 10 times harder than everyone else.
Just to survive a trip to the mall. Yeah.
Yeah.
And then the hormonal shift strips away your acoustic paneling. It unmasks your neurodivergence for the first time because you just don't have the energy to manually run those background apps anymore.
The mask didn't slip. The energy required to hold it up simply ceased to exist.
So once someone finally navigates that murky diagnostic landscape and realizes they aren't losing their mind, what is the actual path to recovery?
Well, it requires a multi-pronged approach that actually respects the biology. First is formalizing that energy accounting we talked about, aggressively auditing what drains you.
Like knowing that if you go to the supermarket, you definitely won't have the cognitive budget to cook dinner.
Exactly. You also have to aggressively create sensory-friendly environments. Noise-canceling headphones, changing the lighting, and crucially, unmasking where it's safe to conserve energy.
What about hormone replacement therapy, HRT?
On the medical side, HRT is gaining significant recognition here. By stabilizing estrogen, you can potentially stabilize those serotonin and dopamine systems, effectively reinstalling some of that acoustic paneling.
Though the clinical guidance notes that autistic people can be super sensitive to medication changes, so it requires really careful personalized prescribing.
Definitely. It's not just a standard dose patch situation.
But I have to bring some reality into this recovery plan. The advice to aggressively rest and implement energy accounting. Is that really realistic for a woman in her late 40s or 50s?
It is the ultimate friction point.
Yeah, like we're talking about the midlife squeeze here. These are people at the peak of their careers, managing teenagers, caring for aging parents. Telling them to aggressively rest sounds like telling them to stop breathing.
I know it does. The societal demands are immense. But from a neurological perspective, burnout doesn't care about your schedule. Recovery requires treating rest as a biological mandate.
Like if you suffered a massive heart attack, you wouldn't ask if it was realistic to stay home from work.
Exactly. The biological reality forces your hand. If you don't rest, the tissue dies. And in burnout, if you don't rest, the executive function does not return.
So the goal isn't just hiding in a dark room indefinitely.
No, it's about building external systems that actually work with the person's neurology rather than forcing them to perform neurotypicality until they collapse again, setting fierce boundaries.
So synthesizing this whole journey, we started by looking at a shattered X-ray machine. And what the research and lived experiences show us is that the invisible labor of masking, combined with the loss of estrogen's buffer, and multiplied by sleep deprivation creates this perfect storm.
A systemic biological breakdown that steals skills, alters identities, and is routinely dismissed by healthcare systems trained only on standard menopause.
Right. And to you listening, understanding this intersection of hormones and neurodivergence does more than just explain a medical phenomenon. It teaches all of us about the biological limits of human endurance.
It really exposes the severe danger of ignoring our body's signals to rest.
Absolutely. But based on the sources, I want to leave you with one final kind of provocative thought to ponder.
Yeah, this was a theme that really echoed through all the lived experiences. If perimenopause is the exact moment when an autistic person's mask finally breaks because they literally lack the energy to maintain it.
Should we really view this burnout purely as a medical tragedy of lost skills?
Right. What if we viewed it as the nervous system's ultimate non-negotiable demand for authenticity?
Oh, wow. I love that.
In a world that asks far too many people to hide who they really are, to rewrite every fiber of their being, severe burnout might just be the body finally loudly saying, no more.
I mean, that is a profound shift in perspective, the biology refusing to manually run the override anymore. Because when the diagnostic landscape is murky, sometimes the only thing left to trust is the undeniable necessity of finally taking off the mask.